And with a stretched budget, officials say there's often very little money left to allocate to mental health. Many who live below the poverty line are forced onto the street with no hope of care or rehabilitation. They are failed by the health system, rejected by their communities, and ridiculed by the families they love.
From your knowledge of mental health care in Africa, is that the same case across all countries, across the board?
I'm afraid it is. It's a very common picture, and people with mental health problems are subject to gross human rights abuses in many parts, not just in hospitals, but also at the hands of traditional healers and in the community, sometimes at the hands of their own family. The reason why mental health is such a hidden and stigmatised condition is because there simply are not the services available. So the people that we've seen in the hospitals in your reports are the tip of the iceberg. They are the few people who are able to access some form of care.
Right now there are only 1,200 psychiatrists in Egypt, a country of 80 million people. That means attitudes need to change. One of the biggest objectives of these reforms is for people to start seeing mental health patients as patients and not a guilty secret.
But the truth and the reality is that very little has been done systematically and deliberately, either by government or by ourselves, to bring up the level of mental health in this part of the world.
Why should policymakers care about mental health?
There is no health without mental health. And there is no economy, and this has been shown in all parts of the world, that in fact there is a relationship between good mental health and productivity. And the converse is also true. Those people who are mentally unwell do not go to their farms, do not go to factories, do not go to work, and therefore a mentally unwell society is economically unproductive. And therefore one of the strategies for improving productivity in any society, including the African community, is to treat those people who are going to work, including the young people, make them mentally healthy and get them to produce. We are losing far too many men and women to mental illness and therefore to unproductivity by not treating them for mental illness.
Iman, a 26-year-old pharmacist, sees her mother for the first time since she was admitted to the Benghazi psychiatric hospital. The previous day, she suffered a psychological breakdown so intense that she had to be drugged and tied to her bed. Iman is just one of hundreds of new patients arriving at the hospital, which serves the eastern half of the country, an area that has been bombed, rocketed, and fought over for almost 2 months.
Allahu Akbar! Allahu Akbar!
The inpatient capacity has been stretched from 350 to 450, even though staff is down over 50% and medication is running low. To make matters worse, the stress that the fighting has inflicted on the civilian population is beginning to take its toll. More and more patients are arriving every day, suffering from mental illnesses such as acute stress reaction and post-traumatic stress disorder.
The people who watch this event, usually they develop severe stress disorders. The current situation, we have a lot of people coming to our outpatient clinic because of the stress they are facing. A lot of the so-called neurotic stress problems among young people, even children.
A 2001 World Health Organization study estimates that 20% of people who experience traumatic events will develop debilitating conditions.